All right, let's talk about diabetes care. We're going to dig into the latest standards from the American Diabetes Association, and what we're finding is a huge shift in how diabetes is managed. It's really moving away from just focusing on blood sugar to a complete blueprint for your whole person health. So, let's explore what that new blueprint actually looks like.
So let me ask you, what does good diabetes care really look like today? I mean, really. If your first thought is just about hitting a certain A1C number, that long-term measure of blood sugar, then you're going to want to stick around. The modern approach is so much bigger, it's way more personal, and honestly, a lot more collaborative. You see, it all starts with a total change in the relationship between you and your healthcare team. The old-school model of a doctor just handing down orders, that's gone. The new model, it's all about partnership.
Now check out the language on this slide. It's so important. The goals are, to prevent complications, but also, and this is absolutely key, to optimize your quality of life. And the plan isn't just given to you, it's co-created. That one word, man, it signals a massive shift. It means you're an active, essential part of the team.
And this right here, this shows what that co-creation looks like in action. It's not a one-and-done prescription, it's a continuous cycle. It starts by looking at your unique situation, your lifestyle, your goals, even how you're feeling mentally. Then, you work together to make a plan. But it doesn't end there. You try it, you see how it's going, and then you review it together, which starts the whole cycle over again. It's a living, breathing process. This whole partnership thing even comes down to the words we use. The shift from calling someone a diabetic to a person with diabetes. It might seem small, but it's incredibly powerful. It puts you, the person, first, not the condition. It gets rid of the stigma and the judgment, and that creates the kind of respectful space you need for a real collaboration. Okay, so if care is a partnership, what does the medical side of it look like? Well, it's not just a quick check-in. We're talking about a super comprehensive evaluation, a full health blueprint that's designed to see the whole you.
And before we even look at any numbers, it starts with your story, your personal and medical history, your journey, what's worked before, what hasn't, your family history. It's like the foundational chapter of your health story. Then, building on that, the next layer is all about real life. How are you sleeping? What are your eating patterns really like? What does your day-to-day activity look like? These daily habits, they're absolutely crucial pieces of the puzzle. And then the blueprint gets even bigger, expanding to your world outside the doctor's office. Do you have a good support system? Are there financial worries or maybe transportation issues that make getting care tough? These things are what we call social determinants of health, and they are so critical for making a plan that's actually going to work for you in the real world.
And of course, there's a really thorough physical exam. And I mean head to toe. We're talking everything from checking your skin, where you might do insulin injections, to a super detailed foot exam that tests temperature and sensation.
And then, finally, the lab work comes in. Your A1C, your cholesterol, your kidney function, your liver function tests, all of it. See, these numbers don't tell the whole story by themselves. But when you put them together with everything else we just talked about, that's when you get that complete 360-degree view of your health.
So, why is this whole person blueprint so important? Well, it's because diabetes is a systemic condition. Its effects can ripple out to parts of the body you might never, ever expect, creating some really surprising health connections. Take a look at this number, 4.35 times. What do you think that represents? It's the increased risk of a hip fracture for people with type 1 diabetes compared to those without. Wow. It's a pretty stark reminder that diabetes care is also bone care.
So why? Why is the risk so much higher? Well, it's a mix of things, really. Diabetes can directly mess with the quality and strength of your bones. Poorly managed blood sugar is a huge factor, and episodes of hypoglycemia, low blood sugar, they dramatically increase the risk of falling, which can lead to fractures. Even some medications can play a role here.
Here's another connection that might surprise you, your liver. There's this condition, it's a mouthful, called Metabolic Dysfunction-Associated Steatic Liver Disease, or MASLD. Basically, it's a buildup of fat in the liver, and it is incredibly common. It affects over 70% of people with type 2 diabetes. And if it's not screened for and managed, it can lead to some really serious irreversible damage. That's exactly why liver function tests are now a standard part of that big health blueprint.
So whether it's your bones, your liver, your heart, your kidneys, these connections make it crystal clear. An approach that only focuses on blood sugar, well, it's just not enough. It's incomplete. Real diabetes care is whole body care, period.
Which brings us right back to where we started, right? This whole idea of partnership. Managing a complex, whole-body condition like this is not a solo sport. It's all about building your defense team and having a really proactive strategy.
And your team can, and probably should, be pretty broad. I mean, of course, you've got your primary doctor, but you might also have dietitians, pharmacists, foot specialists, behavioral health professionals, even your dentist is on the team. Every single one brings a different expertise to support your overall health.
And a huge part of your team's job is to help you play defense, to really focus on prevention. This means taking proactive steps to protect your body against other illnesses that can hit people with diabetes a lot harder.
And a cornerstone of that defense is immunizations. Getting your annual flu shot isn't just about dodging the flu. It's actually been linked to a lower risk of heart problems. People with diabetes are at a higher risk from pneumonia, so that vaccine is critical. And for older adults, the RSV vaccine is now recommended because having a chronic condition like diabetes just raises the risk of getting seriously ill. These aren't just casual suggestions, they are essential defensive moves.
So after going through this whole new blueprint for care, I want to leave you with this one question to think about. Is your current care plan a real partnership? Is it looking beyond just the numbers to see the whole you? Because at the end of the day, that's what the standard of care is all about.